This whole episode is all dick episode.
My favorite.
I mean, I'm a girl, so
As most people who receive dick will tell you, it's more about the girth than the length.
a penis safe seat.
Exactly.
If you will.
Exactly. It's a sex-friendly seat.
Ooh,
Yeah.
we like. Hello, my loves, and welcome back to Love Bites by Dr. Tara podcast. I can't believe it's season 4. And this first episode, I was really thinking about who should be my first guest. And you won't be disappointed because this first guest is one of the most fabulous people I know, and I just can't wait to introduce him. This is Dr. Joshua Gonzalez, who is the Hollywood Dick Doctor and also a board-certified urologist. Hi, Josh.
Hi, how are you?
Do you go by Dr. Josh?
Yeah, I like Dr. Josh.
Dr. Josh
Yeah.
or Dr. Gonzalez?
I like Dr. Josh. Yeah.
Dr. Josh,
Yeah,
okay.
keep it less formal.
Are you having an orgasmic day?
Of course. Friday.
It's Friday.
Yeah.
Friday.
Ready for the weekend.
Are you partying tonight?
Ugh, no. Partying on Friday nights for me is like on my couch with the dog.
Love.
Favorite thing to do.
I love it. I love being cozy.
Yeah, totally.
Okay, so I just read an interesting research, and I want to hear what you think about it.
hmm
Norwegian researchers evaluated 160 men that are cyclists,
hmm
and they found that 1 in 5 of the men had numbness in their penis
hmm
that lasted more than a week, and about 13% of these men developed erectile dysfunction.
Yeah. Yeah, we've known this for a long time. So the first studies that came out relating erectile dysfunction to cycling, I think came out in like the 90s, maybe early 2000s. My mentor in San Diego was a big advocate against cyclists. Like
What?
whenever we had patients come through the clinic when I was a fellow, if he would always ask if people cycled, if they did soul cycle, any kind of stuff like that. The reason is that the arteries that eventually end up as the cavernosal arteries, as well as the nerves that innervate the penis, both run right kind of under your sits bone. And so when you're sitting on your sits bone on a bike, you can have a crush injury to the nerves and the arteries. So it can compromise blood flow, can decrease sensitivity. This is why people get numbness and eventually develop ED.
So your penis is crushed.
Well, the arteries and nerves to the penis get crushed. Yes.
Whoa.
Yeah.
What to do?
So
There's so many men that are cyclists.
yes, there are, and people do it, for mental health reasons. So it's really
Yeah.
hard to.
So is it like a
convince.
give and take?
So there's special seats that you want to kind of
Mm.
avoid those sort of like long, narrow seats.
Okay.
Because those put the most pressure. So they have like seats for guys who develop numbness.
Oh my gosh.
That kind of spread out the pressure exerted to a wider area, so it's not putting it all on the kind of perineal area.
Oh my
So
gosh.
if you can't convince someone to stop cycling, then at the very least you should encourage that they use one of these like more protective seats.
A penis safe seat.
Exactly.
If you will.
Exactly. It's a sex-friendly seat.
Ooh,
Yeah.
we like.
Yeah. Yeah.
Okay, so you guys, this whole episode is just for you. This whole episode is all dick episode.
My favorite.
All about penises.
All about penises.
All about penises. And we're going to answer all of your questions. I see your questions. I get them on the website, via my DMs, on my phone. Like, I get them everywhere. So I want to make sure that I honor your inquiries and that I have the best person to answer all your dick questions. Ready?
Let's go.
10 dick questions answered. Number 1, as a dick doctor,
Uh-huh.
what is the most common concern men come to you with regarding their penis?
Definitely erectile dysfunction.
Wow.
So yeah, I mean, ED, I think a lot of people don't understand is very common. And it's something that can happen to guys at any age. So, historically, erectile dysfunction was thought to be like a disease of older men, right? As we get older, the increased risk of, there's an increased risk of erectile dysfunction for a number of reasons. But if you look at the literature, it's something that can happen really at any age. And the risk of erectile dysfunction goes up with each decade of life. So 30% of guys in their 30s have ED, 40% of guys in their 40s, 50% in their 50s, and so on. So, if you're in your 30s and you're experiencing erectile dysfunction, you're not alone. There's 30% of your colleagues,
Yeah, colleagues.
experiencing the same
Your
thing.
cohort.
Yeah, cohort. Yes. So it's something that happens to guys at any age. So I would say that's probably the biggest thing that I see.
A lot of my followers are Gen Zs, and I'm hearing from Gen Z guys
Hmm.
that they have ED. What is this?
Yeah, I mean, we don't know why there's been an increase. I think it's a couple of reasons. I think number one,
Vape.
the, well, yes, there are certain behavioral things that people are doing that are not helping. Vaping is not good. In the same way that we historically told people smoking tobacco was not good. Number two, you're getting people in the Gen Z generation who have grown up with the internet, who feel very comfortable doing research about these problems and are probably more likely to talk to somebody about it or seek help for these problems
Mm.
more than other generations who felt sort of
Oh.
closeted or embarrassed by what they were experiencing and probably didn't say anything.
Oh, so you're saying previous generation had more like ED too when they were young, but they just didn't say it.
Yeah, I mean,
And
we don't know
kids nowadays have internet, so they're like, I have ED, help me.
exactly, right? So like they have more resources available to
Yeah.
them. I think that's part of it. Thirdly, there's probably environmental factors. We're seeing increasing rates of erectile dysfunction, increasing rates of people with low testosterone, declines in fertility. So this is kind of like a global decline in male sexual and reproductive health. So there's probably some of that effect as well. So it's a lot of things happening, but I think those are the main reasons why we're seeing younger guys with erectile dysfunction.
Wow. Okay, number two. How can men last longer? This is the number one question I get, and
Yeah.
all the time.
Yeah, I think it depends on what you mean by lasting longer. So we should talk about what premature ejaculation is. So
Mhm.
that technically, from a scientific standpoint, means ejaculating within a minute of
Okay, so if
sexual
you
activity.
enter, like insert, or is
Right.
it like just hand job or
So
blow job?
the classic definition is vaginal penetration. There's
Okay.
lots of problems with that, obviously, because people have lots of different types of sex beyond vaginal
Right.
penetration. But the textbook definition is ejaculation within a minute of vaginal penetration.
Okay, so you insert
Hmm.
and you do this.
Couple pumps.
I swear I'm a sex expert. You insert, you do this.
Yeah.
And those that are listening, I'm doing a like dick and vagina hole with my hands.
Sort of a modified fisting.
Trying
technique,
to,
yeah.
yes. But basically this for 1 minute, and if you come within the 1 minute,
That's right.
that's premature ejaculation.
Yes.
So for guys, or really a lot of them are boys that are asking me that are like, oh, like I come within like a song, because they
Mhm.
usually play music, right?
Yeah,
When they have
yeah,
sex,
yeah.
and they're like, if I come within a song, that's not premature ejaculation.
Technically, it's not. Now, as I mentioned, there's kind of problems with the classic definition of premature
Right.
ejaculation, right? So people have different types of sex. There are people who may not meet that strict 1 minute cutoff, but who describe a lack of control, right? They can't stop their ejaculation once it seems like it's going to start. And so, who am I to say that those people don't deserve some sort of solution to that
Remedy.
problem, right? So guys who are having problems controlling ejaculation, let's just say that, can try a couple of things. So there are behavioral techniques, which I'm sure you're familiar with. The start-stop technique, where you stop engaging in whatever kind of sexual activity you're doing. Edging, yeah, that are somewhat successful, but it can be really hard
Mhm.
as a person in the middle of sex to just be like, oh, okay, we got to stop everything, right? So those aren't terribly successful. You
Mhm.
can use barrier methods like condoms, which make you less sensitive. You can use numbing medications to make you less sensitive. There are medications that we can prescribe. None of them are FDA approved, but we
Mm.
use medicines off label to help men have better control. So
Mhm.
there's lots of different options. It's just kind of about figuring out what makes the most sense for you and how bad the problem is.
Mhm.
But things like sex therapy can be helpful. Pelvic floor physical therapy can be helpful. So there's lots of options.
Wow. When people say like lasting longer, I
Mhm.
always wonder like what is it that they're hoping for?
Exactly.
Like are
Yeah.
you hoping for 20 minutes,
Yeah.
45 minutes? Because that's not what I want.
Right, exactly. I mean, I
Yeah.
think, yeah, you need to have a conversation with the person you're having sex with, because
Right.
who knows how long they want it to last, right?
Yes.
But I also think that there is, because of like our exposure to, adult content, let's say,
Yeah.
there's a misunderstanding of what a normal time to have sex is, right?
Yeah.
So like normal people in normal life situations aren't having sex for 45 minutes like they are in that video
No.
that you're watching, right?
Right.
What people don't understand is that there's a camera, there's lighting, there's a
It's a whole
grip,
team
there's a
like
whole team
now.
behind the camera,
Yeah.
right? And they're cutting, they're editing, and so it's not representative of reality. And so I think also one of the things I do in my practice is try to reset people's expectations.
Right.
The average time of sexual activity in the U.S. is about 5 to 7 minutes.
Mhm.
So if you're anywhere in that ballpark, you're doing pretty
Yeah.
good.
And the 5 to 7 is penetration.
It's no from the start of sexual activity.
From like kissing
Yeah.
and massaging my boobies and
Yeah.
all of those
And the thing
included.
is, I mean,
Well, I want 5 minutes just massaging my boobies.
right, and penetrative sex and even ejaculation isn't all that encompasses sex,
Right.
right? There's so many other things that you could do to create intimacy and to increase pleasure, that it doesn't have to all be about penetration and ejaculation.
So I guess probing question to that, how can I last longer? What do you think is like one of the most common or popular remedy?
For ejaculation,
Right.
That's a good question. I think edging is probably one of the things that people read about on the internet.
Mhm.
And edging, let's just say when done correctly, can make it so that you have better control and can
Mhm.
prevent ejaculating too quickly. There can sometimes be problems with edging. So edging oftentimes will involve kind of clenching the pelvic muscles.
Mhm.
And I have actually seen patients who, may already have a problem with their pelvic floor, perform edging exercises at home. Sometimes not even because they have premature ejaculation, just because they want to prolong the kind of pleasure,
Mhm.
who develop pain related to that because the tension increases so much that they start to have
Oh.
pain when they ejaculate.
Painful dick?
Painful ejaculation. So you
Oh.
take a pleasurable thing, right, that we all love, and then it becomes a painful experience. And so a lot
So
of
that's
times
pelvic related.
it's usually related to pelvic floor muscle tension. Yeah.
Wow.
Yeah.
The more you know.
I know. It's fascinating, right?
Number 3. Okay, I get this also. This is
Mhm.
I think this and the how can I last longer are the 2 questions that I get the most. How can men have a bigger penis?
So
Bigger penis. Come on, Dr. Josh.
yeah, there are, I would say, safe treatments
Mhm.
and treatments that I would definitely recommend people not pursue.
Like
So
experimental.
yeah, I mean, they're all kind of experimental. None of them really have good studies
Yelp
supporting.
reviews.
So So what I generally tell people to do is avoid anything surgical, right? Surgery is a pretty major thing to undergo.
Pretty intense.
Yeah. There's not really, in my opinion, been any surgical enhancement procedures that I would consider safe enough to recommend to a patient.
Oh,
There are some
really?
newer things that we're doing. I do these in my practice using penile filler.
Oh, like Botox?
No. So like hyaluronic acid, right? So things that people put in
Oh.
their lips and their face to add volume.
Okay.
We're doing in the penis to add volume to the penis.
I've seen that.
Yeah.
I've seen a video on YouTube of like
Mhm.
an Ohio doctor.
Mm-hmm.
Is that kind of similar procedure? This
I'm-
was like a couple years ago.
I'm guessing. I mean, I don't. There
So
people are
it's-
injecting all kinds of weird shit down there, but yeah. So
but you're doing an injection
yes. So this
into
is
the shaft.
it's into the subcutaneous tissue. So it's not in the erectile tissue. It's sort of between the two fascial layers under the skin. So there is skin,
Fascinating.
there's fascia, another layer of fascia, and then erection tissue, right?
Okay.
So we are putting it between the two fascial layers, which is a very small space, but it allows the filler to kind of spread evenly. And that is mostly a girth enhancing procedure. So it makes your dick thicker,
Ooh.
right? Which will,
I mean, I'm
as-
a girth girl, so
as most people who receive dick will tell you, it's more about the girth than the length. But a lot of guys want length, right? So there's not really a ton of procedures out
so
there.
dick fillers, not really length.
It
more
can make your
girth.
flaccid penis kind of hang lower, but it doesn't
Mm.
really do anything for your erect length.
Okay, I'm so curious. When a guy comes in to get the dick filler, do they have to get hard first?
No.
Oh.
No.
Because that's kind of odd, right? They have
It
to
would,
like
I
get
mean,
horny
listen,
in
I've
front of
done
you.
the
and-
procedure when someone starts to get aroused, and then I just say
Ooh.
like, all right, we're gonna take a little break here, and I'll be back in a few minutes.
Oh my God, you're so professional.
I mean, you have to keep it professional.
I'd be
Yeah.
like, ooh, what's going on?
No, I try to keep. The reason is, a lot of the times that happens because people are really nervous, right? And I'm,
A
I'm
nervous boner?
well, oh yeah, it happens. I mean, you can imagine if you have a stranger in a clinical situation kind of pulling your penis and marking it and cleaning it with Hibiclens and doing all and putting a drape down and all this sort of things, and you're super nervous, like you can get an erection, sort of like guys get when they're in junior high, and
Yeah,
they
like a confusing arousal.
exactly
Yeah.
exactly. They're not. I don't think they're thinking of it as a sexual situation, and I try to just make them feel as comfortable as possible and just say this happens all the time. I'm going to give you a couple minutes and I'll be right back, and then I come back and we finish the job.
We finished the job. I love that you said it so professionally. Okay, like I'm so curious. I've never talked about this with anyone yet. This
Mhm.
is the first time. I think a lot of my audience have heard this. So so you make an appointment, you come in, and you get an injection. Then like, can you use it immediately that night, or is it like
So
downtime?
yeah, so there's a little bit of downtime. I mean, you can go back to like regular daily activity.
But
We
not
tell
cycling.
avoid cycling. We tell people to avoid sexual activity for about 10 days,
Okay.
including masturbation. That's
Okay.
probably the hardest recommendation that we
bet.
have. But I just try to tell people, like, listen, everything I'm going to tell you to do after is really to make sure that you have the best cosmetic outcome. Because what we don't want to do is engage in activities or do things that are going to move the filler around before it has time to set.
Wow.
So we just tell them to avoid sexual activity for 10 days. We put like a little silicone tube over the shaft of their penis that's compressive. So
Ooh.
it kind of compresses the filler in place, and it prevents their penis from retracting towards the body so that the filler has time to set. So they wear like a little, it's almost like a
Wow.
dick cast,
A
but
dick cast.
yeah. And it just allows the filler to like set over time.
Oh wow, that's so advanced.
Yeah.
And then how long does it stay?
That stays on for 3 weeks.
Wow, big dick filler.
Yeah.
Oh, okay, this is like the first time I
yeah,
heard
you
this.
can
I'm
get
so
your friends
excited.
to sign the cast. You can,
That's so fun.
Yeah.
Okay, if any of you get this, like, let me sign the cast.
yeah.
Um, before we move on, I'd like to talk about the sponsor of this episode, Popstar Volume Plus Taste Enhancer. A couple of my friends are taking this, and oh my God, huge loads. And I don't want to like stigmatize, or I don't want to talk shit about guys that like have small load, but it's kind of safe to say like when you do come big loads, it's hot. Right? I think that's
Agreed.
yeah, I think that's like the general consensus. Like big loads are hot.
Yeah.
And I mean, it's good for other things too, right?
Yeah,
like
I
if
mean-
you're trying to get pregnant, like big loads.
And just pleasure. I mean,
Pleasure.
when you ejaculate more, your orgasm is more intense. You have more contractions. And so it just kind of enhances the entire sexual experience.
Yeah.
Yeah.
And I don't think there's ever a time where a guy tells me like, I want my load to be smaller.
Right. Right. Yeah, we don't hear that complaint a lot. Yeah.
No,
Yeah.
I always have guys telling me like, hey, Dr. Tara, like I want a bigger load,
Yeah.
or like, I just want to shoot more. I
Yeah.
feel like more confident. It's related to sexual confidence, sexual self-esteem. So this is not like a vanity product per se. It's
No,
more,
no.
it's to me, it's like much more related to like having higher sexual confidence.
Yeah, totally. I mean, that's why the product was created. I mean, it was born from patients reporting just that very thing. We want to ejaculate more because I remember when I ejaculated more, sex felt better. I felt more confident in the bedroom.
Yeah, and we love that.
We love that. We love sexual confidence.
Yeah, we love sexual confidence.
Yeah.
So, Popstar, you can get it in the link in the episode description, okay? Get it now.
Yeah.
Big load tonight. Okay, number 4.
Okay.
What are some myths about erectile dysfunction that
Good
you've
question.
heard?
Yeah, I mean, I think one of them is what we already kind of talked about, that it's only something that happens to
Old
older men.
guys.
Yeah. Number 2, I would say that it's all in your head. So especially younger guys who, have the courage to come see me for this problem, a lot of them either have convinced themselves or are told by other providers that there's something wrong with them psychologically. And
Right.
the reality is that many men, no matter what their age is, do have anxiety around performance.
Right.
It makes sense, right? If you like to have sex and you can't perform the way you want to, it creates anxiety. That makes the problem worse going forward. But there are plenty of physical issues that can come up that can cause a problem with your erections. And that's what my job is. That my job is to figure out what factors are playing a role, what factors are causing a physiological reason for you to not have good erections. And then once we figure that out, then we find a solution.
And physiological issue, what
Mhm.
are some of the physiological issues?
So the two main ones that we see are like hormonal problems,
Okay.
right? So testosterone is a very important hormone for
Right.
male sexual function, but there are other hormones that can positively or negatively impact a man's erectile function. So we kind of do like a global assessment of someone's hormones and optimize what we can. And then the other one is blood flow. Obviously, the erection is a vascular phenomenon, right? You need to
Right.
get blood into your penis.
Blood
Uh,
flow to the dick.
Good blood flow to the dick is necessary for a good erection, but you also need to be able to trap the blood in your penis, which
Oh.
is kind of cool. It's a unique property to the penis, right? Normally, like if you're talking about a
Unique
finger, you
property.
get blood in,
Yeah,
it drops off the oxygen, and it immediately circulates out.
right.
In the erection, you get blood go into the penis, and it because of what happens to the change in the tissue, you get compression of the veins, and so the blood gets trapped there.
That's
Then
why
you
a lot of guys like wearing cock rings.
Yep, exactly. Yeah. So, and then you ejaculate, and then the whole process reverses, and the blood goes back out. But some men can have problems getting the blood in there,
Mm-hmm.
and some men can have a problem trapping the blood there.
Mm-hmm.
So we figure that out, and depending on which issue they have, then we can kind of create a treatment plan for them.
I have a probing question because
I love
some
probing.
sometimes guys tell me like they don't have ED.
Yeah.
They do get hard, but they don't get that hard. So they get like a semi erection,
Mhm.
right? What's going on?
I don't know specifically. I'd want to like know more about what's going on with them.
Right.
Like, is this happening?
What are
When-
some possible reasons for people that like just don't get that hard, that firm
So
erection?
it depends on what their baseline is, right? Like that's always important to me. Is this something that they've always noticed? What are they comparing it to? Are they comparing it to their friend's erection or to another person's erection that they've hooked up with or to what they're seeing in
Oh.
film? Or are they comparing it to how they used to be, right? So if
Right.
you've seen a decline in your rigidity,
Right.
I would say that's erectile dysfunction.
Rigidity.
Yeah.
Mm.
Um,
I like some academic terms.
yeah.
So,
So-
rigidity is like how hard it is.
Exactly.
Okay.
Yeah.
But so let's say they say in my 20s I was really hard. Now I'm like 35 and I'm not that hard. I do get like an erection, but it's
Yeah.
a semi. Like what?
So that's erectile dysfunction, in my opinion.
Okay.
Yeah. So, and then another thing is when people will describe getting hard, but they have trouble maintaining it, that's
Mhm.
also erectile dysfunction.
Okay.
The definition is an inability to achieve or maintain an erection long enough to complete sexual activity.
Okay.
So, and there are various grades of erectile dysfunction. That there was a scale that was created at the time of the Viagra trials back in the 90s,
Mhm.
and there's grade 1 through 4.
Okay.
Grade 4 is like the perfect erection,
Okay.
rock hard, able to penetrate. Grade 3 is kind of like what it sounds like you're talking about,
Yeah.
which is sort of like a almost fully rigid erection,
Yeah.
still able to penetrate but not fully rigid.
Right.
Grade 2 is sort of like a semi, like
Okay.
but not hard enough to penetrate, and then grade 1 is kind of like floppy.
Oh, okay.
Yeah.
Like look at that.
Yeah.
There's a scale for everything.
Validated scale. That's how they
Well,
like.
But grade 3, sometimes you like if you're the woman, you get up to like cowgirl, and sometimes you try to sit on it. It doesn't like go in.
hmm
It folds
Yep.
if it's grade
You
3.
have to be very careful. You don't want to cause an injury there.
No.
Yeah. Yeah.
That's what I'm asking.
Yeah.
Okay, question 5. What are some tips for reducing performance anxiety in general?
I think one strategy would be, I mean, this sounds really silly, but just like talking to your partner. You know what I mean? Like if it's someone that you're having sex with regularly, having a conversation with them and just kind of telling them what's going on in your head and trying to get to the bottom of why you're having such anxiety. I think that's super important. Communication is so, so important. Other things like meditation, mindfulness can be really helpful. Seeing or talking to a therapist about these kinds of issues, seeing a doctor and making sure there's not anything physically wrong with you. Because I've seen a lot of times when we do find something physically wrong and help someone fix that issue, their anxiety starts to decrease because now they feel confident again. They're fixing whatever problem we found, and their performance anxiety goes down.
Yeah. I mean, I've had guy friends that say they come, like when they come, it's like very small,
Mhm.
and that gives them anxiety too. So
Yeah.
that's like one of the issues.
There's
And
a lot of
just a
different-
lot.
Yeah. people get way too in their head, I think sometimes. Sex is
Yeah.
supposed to be fun, you know what I mean? And so if you're not having pleasurable, fun sex, then, try to get to the bottom of why that is.
Right.
And you might be seeing a doctor, it might be seeing a therapist, there's lots of different avenues.
So when it comes to people that have performance anxiety, and if they say like, oh, I'm taking antidepressants or
Mhm.
SSRIs or one of these, very common mental health related medication,
hmm
what advice can you give them if it's like what they're taking is affecting?
Their performance.
Yeah.
Yeah, it's a good question. So there's a lot of mental health medications that negatively impact sexual function. SSRIs are the most common, I think, or most commonly prescribed and the most notorious for causing problems. They can cause problems with ejaculation. So we talked about premature ejaculation. These medicines cause delayed ejaculation or make
Can't
it
come.
exactly make it difficult for guys to come.
Wow. So if you are taking SSRIs and you feel and you can't come,
hmm
don't worry.
No, I would worry. It would bother me. But it could be related to your medication. So it may be
Right.
worth having a conversation
Like
with your doctor.
switching
Is there
it
anything
or
else I could be
yeah.
taking that wouldn't impact that? Or sometimes seeing someone like me, there
Yeah.
are other medicines that we can put people on to kind of offset those negative sexual side effects.
Okay.
Because the reality is, your mental health is really important, right?
Right.
If you are walking around depressed, that's not going to be good for your sexual function
Right.
either. So there are some people that need to be on these medicines and can't get off of them or can't switch to something else. So we have to find other solutions. And sometimes that involves putting them on a medication to kind of counteract the effects of the antidepressant.
Wow.
Yeah. So, but I think if, at the end of the day, if you're having a sexual side effect from your medication, it's at least worth having a conversation with your doctor about alternatives.
Are there other like major medication or drugs that people take regularly that impact the penis?
Yeah. So there are some people, certain blood pressure medications can
Okay.
make it more difficult to get an erection. There are medications, even in urology, there's a medicine that's prescribed called finasteride, which is a medicine that shrinks your prostate. It helps guys
Oh.
with enlarged prostates, but a lot of younger guys take it in a lower dose called Propecia to prevent hair loss from happening, right?
Uh-huh.
You've probably heard of Propecia. A lot of guys take it,
Uh-huh.
especially younger guys. Those medicines work or interfere with the testosterone pathway. And so they can cause sexual side effects like low desire, erectile dysfunction. There are certain antipsychotics that can cause problems with sexual function. So there's a lot of different medications that
Maybe
can
you just save your money and go to Turkey and do hair transplant.
exactly.
I'm pretty sure that's what Elon Musk did, right? Like, have you guys seen photos of him like in his 20s? He had
Yeah.
like no hair.
Yep.
And then the older he gets, the more hair he
Well,
has.
what's that joke? You're not ugly, you're just poor. Right?
Yeah.
Yeah. If you have enough money, you don't have to be
I
ugly.
would like save up my money
Yeah.
and go get hair transplant. Ooh, talking about hair.
Mhm.
What do you think about people that this is not on my note card, but I'm just so curious. What do you think about guys that like shave their whole pubic hair and like their balls?
Like
is
with a
that
razor?
safe? Yeah. Or wax. Well, whatever the method is, but like they remove all the hair from their pubic area and balls.
Yeah. Honestly, I'm seeing that less and less. I think.
Really?
Thank God. Yeah.
Well, yeah, because you do see penises every day.
every day.
Every-
God bless my job.
Yes.
Yeah. So I'm actually seeing it less commonly.
Wow. So more hairy guys?
Yeah, or just people doing a more natural trim, not doing like the full Brazilian kind of
Was
wax.
that common back in the days?
I think so. I think like kind of in the earlier 2000s and maybe even like 10 years ago, it was more popular.
I can see that. Like Jersey Shore vibes.
Exactly. Gym tan, laundry, and
Yeah.
Brazilian.
Yeah.
But they, so I'm seeing more kind of natural pubic hair, let's say, or trimmed as opposed to full Brazilian. I wouldn't say it's unsafe, but it's, you have to be careful. If you're waxing, you're putting hot wax on your genitals. You can burn your eyelids when you do your eyebrow waxing. The same thing can happen to that skin, and it's more sensitive skin down there, so you definitely want to be careful. Using a razor down there is also something that can be done safely, but obviously if you nick the skin, it's very thin down there, so you can nick it very easily. So I wouldn't say they're inherently unsafe, but you can get ingrown hairs, you can cut yourself, you just have to be really careful.
Okay.
I prefer just a nice little trim, a little clipper.
Little trim.
What
about like the taint area?
Yeah.
Also nice little trim.
Yeah, why not? Yeah.
No waxing.
I mean, I don't want wax near my hole, personally.
If someone, well, my husband's all like, he has no hair.
Oh, wow. Lucky him, I guess. People pay a lot of money for that.
No, I think he shaves.
Okay. Okay.
Yeah, yeah. But I'm trying to think when, like, many years ago, I like hooked up with a guy that really wanted me to like eat him out,
Uh-huh.
and like lick the taint
Yeah.
area and
Yeah.
like
We
eat
call
out
that
like
rimming.
rimming. Yeah,
Yeah.
I forgot about that for a
Yeah.
second. Like
Yeah.
eat him out, rimming. But like he had so much hair.
Oh, yeah.
So much hair.
Yeah.
I'm like, is this ass or is it seaweed?
Oh,
Is it?
yeah. Well, that's like when you give like maybe a little gentle feedback, I guess, depending on like
I
whether
literally just said, is it ass or seaweed?
I'm sure he really
He's
appreciated
like, I thought
that.
Asians like seaweed.
Yeah. That's actually a great comeback. Good for him.
He
Good
was
for him.
charismatic. So I'm
Yeah.
like, fine, I'll fuck you.
Yeah. Yeah. Did you do it again?
No.
Yeah. See?
Yeah.
Well,
It's personal preference. I
Yeah.
really like,
exactly.
I also have no hair anywhere.
Yeah.
I'm like a dolphin, like, oh.
Silky smooth.
So yeah, I would
Yeah.
like to have sex with another dolphin.
Yeah.
Although I do like facial hair. I'm a big fan of
Yeah.
facial hair.
Yeah. I mean, I'm a fan,
Yeah.
obviously.
Yeah.
Yeah.
Okay. Number 6. How can men have better orgasms?
I think number one, doing things to increase your load size will definitely improve your orgasms. Talking to your partner and telling them what feels good.
Mhm.
Maybe making sex last longer and not focusing so much on, just penetration or more traditional definitions of sex. Foreplay can, extend the time of sexual activity a
Mhm.
lot. Doing things like nipple play,
Mhm.
all that kind of stuff can just continually increase that tension,
Yeah.
which will eventually result in a bigger orgasm. So there's lots of things you could do.
So when
Get
men,
creative.
when
Yeah.
men orgasm, can they orgasm without ejaculating?
Yeah. Yeah. So there are one I think the best example is like guys who have their prostate removed because they have cancer in their prostate,
Right.
right? They have what's called a dry orgasm. So they can have sex, and when they orgasm, there's no fluid that comes out because the fluid that normally comes out is mostly made in the prostate. And so when you remove that organ and the seminal vesicles with it, you just have all of the pleasure, all of the contractions that we associate with orgasm.
Yeah,
but
like
there's
it
no
feels the same.
exactly. There's just no fluid.
Just no load.
No
Or is it
load.
like clear?
Nope, it's no load.
Wow.
Yeah, dry.
What's that like?
I mean, I think for people who experience it, if they don't know it's going to happen to them, it's really distressing. If you warn them that it could happen, and they're prepared and understand that that's a natural part of what happens after this kind of surgery, then they can continue to have really pleasurable sex because the orgasm is still there, right?
Yeah.
So as long as they're not trying to have kids, then it's not
Right.
a big issue.
Wow, then it's really good. Then you can have sex raw.
Yeah.
No
Yeah,
condoms.
no cleanup.
No one getting
Yeah,
pregnant.
but no facials too. So I guess you can't
That's
really do
true.
that. I know.
I do like a facial.
Same.
Oh, I love you. Number 7. Why do some men have a low sex drive? Like there is a stereotype, and
Yeah.
it is a stereotype because I was actually married to someone that had a low sex drive. But
Mhm.
there is a stereotype that like men just want to fuck all the time,
Yeah.
right? And it is a stereotype. So why do some men have a low sex drive?
There's a lot of different reasons. So hormone health is really important. As we get older, testosterone declines. We often see declines in libido associated with that decline in testosterone. But what I always like to start with is asking a person, is this something they've always experienced? Are they someone who is always identified as having low libido? If that's the case, then maybe there's nothing wrong. Maybe that's
Right.
just them, right? They're a group of people that refer to themselves or identify as asexual. There's nothing
Right.
inherently wrong with that. That is just how that person is
Right.
and how they're built.
But if
When-
it's distressing for them,
exactly
like, oh
when
man, like,
desire
why am I
becomes
not?
when low desire
Yeah.
becomes a problem is when it's a change from some
Right.
sort of former baseline and it's associated with distress or maybe causing a problem in a relationship. So in those cases, we evaluate their hormones. We talk to them about medications.
And that's mainly testosterone, right?
Mostly testosterone, yeah. There's some other hormones that can negatively impact libido, but then we talk to them, what medications are they on? Are they on an SSRI? Maybe that's why they're having the problem. Are they in an unhappy marriage? Maybe that's why they have low desire.
Ooh.
So there's lots
Do you
of
ask
different
that
things.
question as a dick doctor?
I asked them about their relationship for sure.
How's your marriage,
Yeah.
David?
Exactly.
Your dick don't work. How's your marriage?
Yeah. I never make that assumption. I never tell them, well, maybe it's your marriage, but I do ask them
It's
about
Mary.
what their relationship is, right? Like it's not uncommon if you're with somebody for a long enough time that your desire to have sex with them or to fuck them is gonna go down. Like,
right,
right?
right. Like it's a
So
natural,
it's natural.
hopefully small decline,
Right,
but
right.
there's
But I
some
think
kind of
but I think if they're motivated and their partner is motivated, there's ways to kind of rekindle
okay.
that spark, right? Try something different. Maybe you invite someone else in. Maybe you do new things in the
Ooh,
bedroom
freaky
to kind of
doctor.
stay. I'm
Okay,
just a realistic doctor.
I have a probing question
Okay.
about testosterone.
Okay.
So let's say a guy, I know that there's like, isn't there like an internet test for testosterone that people buy? Like it's like in a box and,
Yeah, I think there's
okay.
a few different companies out there
Okay.
that offer like at-home kits.
Let's
Uh,
say someone has low testosterone. What can they do?
So it depends on their age, number one, and also whether or not they want to preserve their fertility. So testosterone replacement therapy there's several different ways to do that, is something that we can give somebody who has low T.
Okay.
The problem with it is that it can, when someone goes on TRT, it can interfere with their sperm production. So
Mm.
they may unwillingly be causing a fertility issue. So we always want to make sure that we
Oh.
talk to patients about whether or not they want to have kids in the future, because TRT may not be the best option.
But then can you like, okay, let's say you do the testosterone
Hmm.
supplement, and then can you take then like sperm supplement?
Not always.
Okay.
So yeah, so if you're shutting down your sperm production because you're using exogenous testosterone, even if you stop the testosterone, it's not always a guarantee that your sperm will come back. So sometimes we have to put people on alternative medication to try to like re-stimulate their testicle to make more sperm, but it's not
Okay.
always successful. So
Hmm.
I always try to start out by figuring out whether they want to preserve fertility. If they do, then we offer them other treatments that basically stimulate their body to make more testosterone rather than replace it.
Wow. Thank you.
Of course.
Number 8. Circumcised or uncircumcised?
Are you asking my preference?
No, I didn't finish reading the question. Circumcised or uncircumcised? Any difference in pleasure?
No. So well,
it's a myth when people
let me
say
clarify this.
when
So,
you have a cut dick or circumcised dick,
Yeah.
it's not as sensitive.
so let's clarify. When we talk about neonatal circumcisions, like when circs happen when you're a baby,
Yeah.
there is no data to suggest that grown men who had neonatal circumcision and grown men who have a foreskin intact have any difference in sexual satisfaction or
Okay.
sexual function. If you are an adult man who gets circumcised for either cosmetic reasons, or maybe you
Yeah.
have a functional problem with your
Yeah.
foreskin that necessitates a circumcision.
Yeah, those that are like foreskin like doesn't come down.
Yeah, it's called phimosis. So that's a medical condition that sometimes needs to be treated with circumcision. In those men, they will sometimes report a decrease in sensitivity with removal of that skin, and it may, for a short term, negatively impact their sexual pleasure. But a lot of times, their brain readjusts to their new penis, and they can get back to whatever kind of baseline fulfillment they had.
Oh,
So
love
it
that.
is-
a happy ending.
Yeah, we love happy endings.
Yeah.
Yeah, so it is a bit of a myth in terms of there's no difference between sexual satisfaction.
Okay, that's great.
Yeah.
Yeah, I know that a lot of my male followers that are either adults that just got circumcised or are interested in it for cosmetic reasons,
Mhm.
or concerned if it would make them
Yeah,
go
I mean,
like
in
numb
general, if you
completely.
have a perfectly functioning foreskin, leave it.
Okay.
I would not recommend people do it for cosmetic reasons. If you have a functional problem, phimosis or some other issue,
Right.
then it needs to be done. But in general, if your foreskin works, just leave it. It's got a bunch of nerve endings on it.
It's hot.
Yeah.
Okay, number 9. What happens when a man breaks his penis?
Oh, not fun.
Have you seen patients like that?
Oh yeah, my co-founder, actually, I was on the phone with him right before this, is going to the ER to fix a broken dick. right now.
No!
Yeah, I know, it's not fun.
Fixing a broken dick.
Yeah. Yeah. So you were talking about earlier sitting on somebody who may not be fully erect.
Right.
That's one of the most common causes of a penile fracture.
Okay.
That's what we refer to as broken dick, right? Where the erectile tissue buckles from the
Oh.
pressure and cracks.
I like your
Yeah. And then you get
and
like
it cracks.
yeah, and
So
then
is
you
there
get
sound?
sometimes you hear a pop, yeah. And then you get what's called an eggplant deformity, which is funny because we all use the eggplant
Yeah.
emoji, but your dick literally looks like an eggplant because it gets big, bruised, and swollen. And then you go to the emergency room, and we have to take those guys to the operating room, and where the hole in the erectile tissue is, we have to sew it up. So it's a pretty serious issue because if you don't fix it quickly enough, you can have permanent erectile dysfunction. Yeah.
No.
Yeah. So if you have a partner on top, always make sure that you're not inebriated and that you have a really good erection before you try to stick it in because you don't
Yeah.
want it to
We
buckle.
want the number 4.
What's
the
that?
number 4
We want
erection.
a grade 4 erection.
Yeah.
Yeah.
Okay. So number 4 erection before cowgirl.
Exactly.
Okay. All right.
Exactly.
Last question, number 10. I get this a lot too.
Yeah.
How can a man come a bigger load?
Good question. So there's a lot of things that influence load size. Hydration is key. Number 1.
Drink your water, guys.
Drink a lot of water.
I feel like people have water issues.
Oh yeah, I'm terrible at drinking water, and I'm a urologist. I'm supposed to drink water all the time. Yeah,
Why don't you have one of those like huge bottle? Like
I do. My problem is when I drink a lot, I have to pee a lot, and I'm just
is
like
good, right?
running between patients. Like, I gotta go to the bathroom real quick. So
it's work related.
yeah, I sort of like self dehydrate for that reason, but it's not good. So drink a lot of water.
Okay.
Number
what about
2,
like Pedialyte, like those things? Does it affect at all?
yeah, because those are hydrating fluids. So yeah,
Okay.
that can certainly help. Avoiding toxins like tobacco, alcohol, those are going to negatively impact ejaculatory health. And then taking a supplement, right? So
Yeah.
there's ingredients, all of which we've included in Popstar,
Yeah.
that help to increase volume.
Yeah. So what are like the major ingredients
Yeah.
in Popstar?
So the 3 major ones that increase load size are pygeum, L-arginine, and zinc. And those have all been shown in medical literature to increase ejaculatory volume. We know this from plenty of reproductive data. So
And it's a lot of studies.
yep, yeah. So most
So
of-
people are always like, is it just from one study?
no, there's multiple studies that have shown increased volume from these substances. And we know this from the fertility literature. So no one looks at volume as it relates to pleasure in
Right.
in medicine, but they all care about it as it relates to fertility, right?
Right.
So we took that data and said, well, if we know that these substances increase semen volume, then we got to put them all together
Okay.
to create this supplement. And while we were at it, we thought, why not add ingredients that sweeten the taste so that you get bigger loads,
I
better
need
tasting
to
loads.
unpack this because,
Yeah.
like, of course, I want, like, as a partner to a male with a penis, if I'm giving a blowjob and if you're gonna come in my mouth, I want it to taste like not bad,
Yep.
right? I wouldn't go as far as like, oh my god, tastes so good. It's
Sure.
not ice cream,
Sure.
but not bad,
Yeah.
right? And what are some of these ingredients that are in this?
Yeah.
What are the ingredients that make it taste better?
So bromelain is the main one. That's a
Okay.
pineapple extract, and then there's fructose, which is a sugar.
But like bromelain.
mhm.
So people say this all the time, like, oh, I eat a ton of pineapple.
yeah.
Like, should my cum taste good? Like,
Yeah.
should their cum taste good?
So yes, but you have to eat a lot of pineapple.
Oh,
like
so is there a lot of pineapple in
yeah,
here?
it's a concentrated extract.
Oh.
Yeah. So this is like
wow.
taking the place of having to eat like 10 pineapples.
Oh my god, my
yeah, and
tongue
it's
would
not gonna
hurt so bad if I
necessarily
eat
make
10
it-
pineapple.
It's not going to make it necessarily taste like pineapple, but what
Right.
it does is it neutralizes that kind of bitter taste and sweetens it a little bit. So it's a more pleasurable experience for your partner.
So it neutralizes
Mhm.
bitter taste
Mhm.
in natural like cum.
Yeah.
Wow.
Yeah.
Technology.
It's fun for everyone.
Yeah, wow, it's fun for everyone.
Yeah.
Okay, well, before you go,
Yeah.
I have last question.
Okay.
What's your hottest take on sex and dating in 2024?
Ooh, sex and dating in 2024. That's a good question. I would say just to like have more sex. I think there's I've read a lot of data that have shown that younger generations, let's just call me an elder millennial. That younger millennials and Gen Zers are having less sex. They're
Mhm.
interacting with each other less. They're dating less.
Mhm.
And aside from that, maybe causing a problem with population growth, I think it's there's so many terrible things happening in the world at any given moment that sex is one of those things that we all have the capacity to enjoy, right?
Mhm.
And so get out there, meet people on the street, get off your phone, have more sex.
Yes.
Yeah, it makes
Have
the world a
more
better
sex.
place.
Come bigger loads.
Exactly.
Where can everyone find you?
So I'm on social media at Joshua Gonzalez MD, and my practice is in West Hollywood. So if you guys are in LA and having any problem that you need help with, you can contact my office or DM me on Instagram or TikTok. And Popstar, we have a pretty decent following on Instagram as well. It's at Popstar Labs.
And Popstar is founded by you and another doctor, and both of you are board certified urologists.
That's right. And
Ivy
men's
League
sexual health
docs.
experts. What's that?
Ivy League docs.
Ivy League doctors who spend all day, every day helping men with their sexual health.
Yeah.
Yeah.
A true dick doc.
Yeah.
Thank you so much.
Of course.
And
My
my loves, thank you so much for listening till the end of the episode. I love you. I appreciate you. Wouldn't be here without you, consuming the content, liking it, sharing, commenting, and sending it to everyone you know because, together we can spread more sex positivity and the world's a better place when
We
it's
love
more
that.
sex
More
positive.
sex makes the world a better place.
Love that.
Yeah.
Well, if you love this episode, please do share, comment, like, all the things. Subscribe to Love Bites by Dr. Tara podcast on YouTube, on Spotify, on Apple, or anywhere you're getting your podcast. I love you guys so much. Welcome back to Love Bites by Dr. Tara podcast. Bye.
Thanks for listening. This was Love Bites. Love Bites. By Dr. Tara. Follow Dr. Tara on social media at lovebites.co. Have an orgasmic day.